Hi, Devin West here. I run Medicare Savings Solutions. In this video, I wanted to go over turning 65 Medicare and some of the biggest questions that I get all the time from people turning 65. Stay tuned. Normally, the first question that I get is, do I need Medicare Part B? Well, you do want Medicare Part B, but if you already have employer insurance or if you're not retired, you can choose to delay the Part B until you need it. A lot of people do take Medicare Part B while they are still working and have other health insurance as well, just to work along with that health insurance. So if you don't have any health insurance besides Medicare when you're turning 65, you definitely want to take Part B to make sure that you don't get penalized in the future for not having it. How much does Part A and Part B cost? Well, Part A you've paid for through your working years, or your spouse has if you're taking Social Security under your spouse's benefits. Part B is going to be, right now in 2016, for people that already have Medicare, it's $104.90 per month. And for most people that are getting on Medicare new in 2016, it's $121.80 per month for them. These costs can rise every year, and it can be higher for people that are making a lot more money. So always ask to make sure that you know which premium that you will fall under. It'll be different every year. So again, 2016, the people that are new to Medicare will pay $121.80 per month. When they are turning 65 and getting on Medicare, a lot of people ask me if a Medicare supplement plan or a Medicare Advantage plan is better. Honestly, it depends on the person. Personal preference, finances, health situation, all kinds of things can play a factor in which plan is best for someone. And it's really hard to say which is. So we help people figure out which plan is best in each category, and we help people figure out if they think that a Medicare supplement plan or Medicare Advantage plan would be better for them when they're turning 65. Some people don't mind being on the side of the gamble where they pay a low monthly cost but then have higher out-of-pocket costs when they have to use the plan. And other people like to be on the side of the gamble where you pay a higher monthly cost and have very low to no out-of-pocket costs health-wise. So it really depends on the person and what their needs are. We go over everybody's needs to make sure that they get the best plan for them, which could be different from their neighbor, their husband, their wife, or anyone else. So always make sure you get the best plan for you. I get asked all the time, which company is the best? Well, it depends on what type of plan you're talking about, and the area that you're in and the costs of those plans. So if it's a Medicare supplement plan, the lowest cost plan F or plan G is typically a really good option, but you just still want to make sure that it's a reputable company so that your rates don't go skyrocketing after you get on the plan. There's a lot of companies that come into a market and are very new and will undercut all the others for about a year or two, and then they will skyrocket in their premiums, and you might be stuck in that plan if you can't switch to another. So just be careful which plan you go with or which company you go with, because it does make a difference in the end, depending on whether or not they're a strong company or if they have been in the market very long. As far as Medicare Advantage plans go, it depends on which area you're in and what their network is. A lot of these plans are HMOs or PPOs, so in your area you want to make sure that whatever plan that you're choosing has all of the doctors that you need to see in that area, and all the hospitals and everybody else, so that you don't get stuck with a plan that's not going to cover you at your providers. So make sure you always check the provider lists before you sign up for a Medicare Advantage plan, because that can get you in trouble if you can't see the providers that you want. And it comes back and bites the agent in the butt too, because they didn't know that you were seeing a doctor. So always be upfront with the agent as well. They should be asking you all of these questions. That's what we do. We make sure that you get a plan that your doctors are going to be accepting. So just make sure that that happens. A lot of people that are turning 65 ask me, who should they talk to? Well, obviously I would want them to talk to me and go through me for their Medicare needs. But if they can't or won't for some reason, I let them know that there should be two different kinds of agents you should be aware of that you do not want to talk to. These are, for one, lazy agents, and then the second type is a captive agent. A lazy agent is an agent that's going to sign you up when you turn 65 and you'll never hear from them again. That's fine if they get you the right plan when you're turning 65, but in the future, if you can't get a hold of them when your rates skyrocket or your plan benefits change, then you could get yourself into a lot of trouble not being able to get a hold of that agent, and you'd have to go through the trouble of getting a new agent and finding someone that is reputable and honest. So be very careful of who you talk to as far as an agent goes, because if you pick the wrong one, they can really end up screwing you up if you're not careful, because they'll sell you a plan that's maybe not right for you, or they'll sell you the right one, but you'll just never hear from them again. So just be careful. The other type of agent that you want to be aware of, again, is a captive agent. And a captive agent is an agent that can only represent one company. They're employed by that company and they can only offer their plans. So they will tell you that that plan is the best thing for you no matter what, and you just want to be very careful, because that might not be the best plan for you, and it can get you into some financial issues down the road if you're not really careful about that. And because they're a captive agent and they only represent that company, a couple years down the road, if you need help because your rates went up or your benefits changed and you need something else, or you just need better coverage, they won't be able to help you because they only represent that company. And they'll still tell you that that plan is the best thing for you. So a lot of people just get stuck that way and don't know who to believe at that time. So make sure that you talk to, instead of a captive agent, you want to talk to an independent agent. An independent agent is an agent like me at Medicare Savings Solutions. We represent all of the top companies and all of the top plans available to you, so that we make sure that you are on the best available plan for your specific needs at any given time. And with us, since we've been doing this for since 2007, and I've helped hundreds of people every year that are turning 65, as well as people that are already on Medicare, get plans, switch plans, or even cancel plans sometimes if there's something that I can't help them with. But that being said, we help people every single year to make sure they're always taken care of. You're never left high and dry. We're not lazy agents, and we're not captive agents. So in the future, if we end up having to switch you to a different plan to help you out, we have no problem doing that. And we keep up with you and make sure you know about any huge rate increases that are coming or benefit changes. So that's the advantage of an independent agent over a captive agent and a lazy agent. So make sure you are very careful who you talk to, because that can make a big difference later on. So by far, one of the biggest questions that I get is, what is the best Medicare supplement plan to have? Is it the Medicare Supplement Plan F or the Medicare Supplement Plan G? Well, it really depends on your area. If you're in California, the best Medicare supplement plan could be the Plan F. If you're in Ohio, the Plan G Medicare supplement could be the best for you. It really, again, depends on your area, and in most states, the Plan G is going to be the best option because it's so much less monthly cost that having to pay the annual Medicare Part B as in boy deductible, which is $166 a month or a year right now, doesn't make a whole lot of difference. So that is because the Plan G typically is $40 or $50 less per month than the Plan F, and can save you hundreds over the year, even though you have one out-of-pocket deductible, where on the plan F you wouldn't have that. And that's the only difference between the two plans, is the plan F covers the annual Part B $166 deductible, where the plan G doesn't. After that, everything is covered the same at 100% medically. So you just want to make sure that in your area you talk to somebody, an independent agent that knows the plans and your area, to make sure that you get the best option for you, which could be different from someone in another state or even from your neighbor. So it really depends, but in most cases it's the plan G. You just really want to make sure so that you're not paying more per month, or you're not getting the coverage you need. Then the other big question is, what is the best Medicare Advantage plan available? And that really depends on your area. Every zip code has many different plans. So you could be in a zip code where the next town over is in another zip code and they have 10, 15 different plans, and you may only have 2 available or 0. So it really depends on the zip code and the benefits to the plan. A lot of different areas have different benefits for the Medicare Advantage plans. Some of them have higher premiums, which may be better to go to a supplement plan in that area. And some of them have really low premiums, in which you really want to make sure that you get a plan that has a low out-of-pocket maximum and low deductibles, low co-pays, to make sure that you're not having a lot of out-of-pocket expenses. Insurance is what it is. It's to insure you against the what ifs, and unfortunately sometimes you have to pay money for that. There are, however, some 0 monthly cost Medicare Advantage plans available in certain areas, in a lot of areas. Some of them, like in Florida, there's a lot of them that cover very well, and they have a lot of plans that could be a really good option. But in Washington or Oregon, a lot of them, the 0 monthly cost plans, they're still good coverage, but they're not, you'll have a lot of out-of-pocket costs if you actually have to use it. So it just really depends on your situation, which plan is best and which company to go with. The biggest thing for a lot of people is you want to make sure that your providers are going to be included in whatever plan that you choose. So make sure you choose a plan that is, I usually want to go with a plan that is a bigger name, meaning a bigger company like Humana or United Healthcare or Blue Cross Blue Shield. You just want to make sure you don't go with a small company, because the network of providers could be very small, and a lot of times those companies have less money to pass around for your benefits. So just be very careful and make sure you talk to, again, an independent agent or somebody that really knows the plans and your area, to make sure that you get the best available plan for your specific needs. It can be different from your neighbor, your mom, your dad, and your husband even. So a big controversial question that I get a lot from people turning 65 and going on to Medicare is, should I take the Medicare Part D prescription drug plan? I don't take any medications. I never take a pill. I only take a baby aspirin. I don't need the plan. This is what all the people say that don't want it and want to try to go without it. You can go without it, however, you will be penalized when you finally need it. So, and you can only get onto the plan in your annual election period from October 15th through December 7th of every year, if you wait past your turning 65 initial enrollment period. So, even if you wait past your initial enrollment period just for 1 year, you'll get penalized when you get the Medicare prescription drug plan. You may not need it now, but you could need it in the future. And I've got people that I've had as clients for 9 years that waited 10 years before they got a prescription drug plan, and they're being penalized heavily for it. Some of them paying double the cost of a Medicare Part D prescription drug plan and what that would cost at the current time. So for someone new, it could be $40 a month, but for you who waited 10 years to get a Medicare Part D prescription drug plan, it could be $80 per month. So it definitely is a good idea to get the Part D prescription drug plan when you're first eligible. I do understand people's point of view when they don't have any prescriptions and you don't pay anything for medications right now, but you may in the future. So just be careful, get it when you can, or you could be penalized when you need it. These are just some of the questions that people have when they're turning 65. There are, of course, a lot more questions that people have. I'm sure you have a lot of questions as well. If you do have any that you'd like to get answered, you can always call us at 1-800-663-5707. We are completely unbiased and our services are free. So if you need help with any questions or you need help choosing a Medicare supplement, Medicare Advantage, or Medicare Part D prescription drug plan, we'll help you, and it's all free. We don't charge you a fee or anything like that. So if you like this video, please share it, like it, comment on it, whatever you can do, any engagement with the video that you can make. It really makes a difference for us and helps make sure that we give good content for you guys.